Good morning, and thank you so much for having us.
No
It's quite
problem.
exciting to
Of
be here
course.
and in studio this morning as
Of
well.
course.
Although it's remote, it's
Yes.
it's fantastic.
Thank you.
So basically, stoma is a lot of our patients would have undergone surgery and to the colon, and as a result, they have an opening which is through the skin, through the
Mm.
abdomen, and they have a pouch outside the
Yes.
abdomen.
Yes.
So, if we look at colorectal cancer, currently it's among the top three cancers
Mm.
among both males and females.
Okay.
So, I mean, if you looked at it 10 years ago, it wasn't even among the top five cancers.
Yes,
So,
exactly.
it is regarded as a lifestyle related cancer.
Mm.
So, when you think of an opening outside your body,
Mm.
where your feces,
Yes.
accumulate, it's not a very pleasing
Mm.
and comfortable
Yeah.
situation. And so we have a stoma department, and we are based in Pretoria. But we run clinics throughout the country.
Wow.
So if we look at KwaZulu Natal, we have a clinic in Durban, in
Mm.
Umbilo Road. So when we run the clinics, we have patients that book in, and we have a stoma therapist coming in to see them, to give them advice and support and things like that. Now, the big problem we have, as you know, most of our people depend on the public sector
Yes. Yes.
for services.
Yes.
And the problem that most of our patients experience is the lack of stoma bags. So if you think about
Okay.
it, you need to have something to ensure that your
Yes.
excrement offloads into
Yes, of
it.
course.
So we find in the public sector, the clients would go and they have very limited bags that are issued to them.
Mm.
So sometimes they have only 5 bags for the month.
Oh my
And
gosh.
it is
Yes.
really, I think the problem is the shortage
Mm.
of the bags in the public
Mm.
sector. And often it's also patients don't know how to use the bags, lack of knowledge
Yes. Yes.
and things like that. So we do get stock, we get donation stock from time to time, and we are able to help the public sector
Mm.
clients with that.
That's absolutely amazing. But that's, that also creates for me what I think of when I think of these people who have to go through these with that because they themselves, I can't go out there, I can't be seen like this, or they have the mental challenge of what happened to me and they don't know. And talking of mental challenges, there are so many challenges that I know patients with cancer deal with. They battle with cancer, and some of them have won those battles, but some of them are really battling with it mentally more than anything else. They find it hard to almost regain their life's purpose or balance itself. So what do you think is the reason for this? And I know we spoke now of the stoma and the difficulties, but in terms of generalized cancer people and patients, what do you think is their general mental health capability and how can they regain their balance in life?
Yeah, I think we are quite resilient as
Mm,
people, hence the
yes.
human form,
Yes.
and many people can actually go back to living a normal life.
Mm,
But it is life changing.
yes.
Cancer is life changing,
Yes.
in both a negative and a positive way.
Yes.
So if you think of the negative, your experience can have a lot of emotional scarring, and the changes that your body undergoes also it's quite a lot for people.
Mm,
But on the positive side, you when you speak to survivors that have survived cancer, and a lot of people do
yes.
survive
Yes.
cancer, you find that they have a different purpose in life,
Yes.
a
Yeah.
more meaningful life once they've been through it.
Mm,
And even children, I mean young adults, undergo that go through cancer. When they grow up, they have a more leaning towards support and helping
and then they
humankind.
also have a separate level of appreciation for their lives and how they can
When we're young, we take life for granted,
absolutely.
and we think about childhood cancers.
Mm,
Childhood cancers are actually growing right now, and we're finding more and more young children being
yes.
diagnosed with cancer. But on the
Mm,
positive aspect, the most important thing in terms of cancer and a cancer diagnosis is early detection.
yes. Yes.
You
And
know,
that is why I think today's event, which we're at, is also very important because it creates that education level where people understand and become more aware of what it is. Lorraine, I wish I had more time with you, but I just want to ask, what would be your motivation words for our listeners out there before I close?
I think don't fear the
Yes,
unknown. I
yes.
think that's the
I
most
love that.
important message we could leave with
Yeah,
anyone.
yeah.
And don't self diagnose yourself.
Mm,
Don't put away your appointment.
mhm.
Self care is so important. Whether you've experienced cancer or not, you need to take time and make time for yourself.
Absolutely. Absolutely. Lorraine Govender, thank you so much. I think we do have to have Lorraine back to give us more insight into this perhaps next week or so, but I will discuss with Shabnam. There's so much more we can discuss with you. Thank you so much for making time to be with our listeners and with ourselves today. I know today's event is going to keep you busy, but all the best to you, my dear sister.
Thank you so much for having us.